Assessing the patient experiencing a mental health emergency by Jones HMMBADMS. Once the patient's behaviors are under control and safety is secured, assessment continues in order to determine the underlying cause of the patient's presentation. Mental health crisis emergencies can arise due to a medical condition, substance use or abuse, or a psychiatric disorder. The assessment includes clinical interview and mental status examination, assessing for medical causes, assessing for substance use causes, assessing for mental health disorders, clinical interview, and mental status examination. An emergency psychiatric evaluation is often requested when a patient presents with an immediate harm to self or others, when such a threat is thought to exist, or when there is a need to identify a psychiatric diagnosis. A clinical interview is conducted face-to-face to gather pertinent data and explore the presenting problem. The interview method is modified to match the circumstances, age, and cognitive ability of the person in crisis. Data collection is enhanced by information gathered from family members, other healthcare providers, and authorities such as police officers. Assessment includes the person's perception of the event, situational supports, and coping skills. See also crisis intervention model earlier in this course. The face-to-face clinical interview should take place in a quiet, safe environment, and the maintenance of such an environment should be emphasized to the patient at the beginning. Patients may require medication prior to being interviewed, and if a patient is potentially assaultive, it is best that the interview be conducted with multiple staff members present. If the patient is in restraints, the initial step should be to let the patient know what is required in order to have the restraints removed. If the patient is not restrained, the clinician should not block exit from the interview area or be situated in such a way that there is no escape. The clinical interview begins with identification of the chief complaint followed by the history of present illness. If the patient is capable, a longitudinal history of the course of the illness can be explored, but if the patient is too impaired to completely participate, the emphasis should be on the current episode. The history of present illness should include information about how the patient was functioning prior to the episode, the current symptoms, whether there is a past history of prior episodes, and what the precipitating factors were. It is also important to examine recent or chronic stressors and their severity, and to assist the patient to connect the stressors to the symptoms of the current crisis. The patient should be asked about any psychiatric history, past treatment, and illness episodes. It is important to remember that a denial of a history of mental illness in the past should not be accepted without further inquiry, as stigma may play a significant role in unwillingness to disclose such a history. A review of systems should be done to attempt to discover other issues not brought up during the history of present illness, Scher, 2018. Moore and Pfaff, 2020. A mental status examination is a standardized format for the collection of data to evaluate, quantitatively and qualitatively, a range of mental functions and behaviors at a specific point in time. Subjective and observable data obtained is combined with the patient's biographical information, history, and physical for the purpose of making an accurate diagnosis and determining appropriate treatment.